I always answer these questions correctly, but don't seem to do the best on Hesi. I only got an 800 so far. Keep practicing. When it comes to Hesi, most of the questions are based on three things. They're based on priority and delegation, they're based on the nursing process, and they're based on ABCs, airway, breathing, circulation. So let's talk about priority and delegation. Hesi expects you to know what type of patients you're going to keep versus what type of patients you're going to delegate and who you're going to delegate it to. This might be more than one part series because it's a lot to unravel. So, as the registered nurse, who are you going to keep? You cannot delegate this patient to anybody else. Any patient that has something acutely happening to them, okay? There has been a change in their status and the change is not good because obviously if the change is good, the patient's getting better, we're not concerned. But any patient that has something that's going on that they're getting worse, you have to keep that patient. So you got to watch out for words such as suddenly or all of a sudden. If you look at the labs, the patient's been doing better and then the labs are getting worse. Well, they're not saying all of a sudden, but you see the trend. They want to see, can you see that there is a change? So if you see a trend that the patient's been doing good, now all of a sudden, heart rate's elevated. All of a sudden, respiratory is up. All of a sudden, WBCs are up. All of a sudden, ESR is increased. You understand that something's going on with this patient. We don't know what's wrong with them yet. That's why you got to keep that patient because you are responsible for assessing that patient, right? So any patient that has something actively happening to them, there is a change, you have to keep that patient. Now let's talk about the type of patients that you can delegate. You can delegate the most stable patient to your LPN or your LVN. Now, depending on the state, the scope of practice is different, but pretty much all the states, they can give medications. They can give PO medications, routine medications. Remember, you as the RN, you've already done that initial teaching. You did that at the admission because only the RNs can do the admissions, right? So you did that initial teaching. What the LPN or LVN does is they keep it going. So they're not just going to administer the medication to the patient. They're going to remind the patient, hey, don't forget this antihypertensive medication. It may cause orthostatic hypotension. So if you need to get up to go to the restroom for any reason, be sure that you press the call button so I can help you ambulate so you don't pass out, right? So they can give routine medications. Most states, they can give IV medications. What they can't do is piggyback. What they can't do are pushes. What they can't do are give blood, right? But routine IV meds, they can do. What they can't do are central lines. Let's talk about UAPs. What can you delegate to the UAPs? UAPs can do lots of things. They can take vital signs. They can take blood pressure, pulse, respirations. Can they listen to the lungs? No. Why? Because that requires critical thinking. You got to know what you're listening to. Are you hearing crackles versus rails versus rhonchi versus wheezing versus stridor? Do you see what I'm saying? I'm not saying that unlicensed assistive personnel don't know how to think critically. I'm just teaching you how to answer the question correctly. If it requires critical thinking, you cannot delegate that to a UAP. So you have to know priority delegation because you get lots of questions that are priority delegation. You got to know the nursing process. When you look at the question, where are you in the nursing process? So in the question, did you just realize something's wrong? Because if you just realize something wrong, your answer is always going to be to assess. You got to find out what's wrong with your patient. Now, in some questions, you did assess because in the question, they tell you that you looked at your patient. They tell you that you looked at the chart. They tell you that you looked at the labs. They tell you that you did a physical assessment. So in that case, if you already assessed, right, then you're going to come up with the plan, a nursing intervention. In some questions, they tell you that you just performed a nursing intervention. So what's your answer going to be? Evaluation. You want to see if your nursing intervention worked because if it did not, guess what? You're back to assessment. So you have to understand the nursing process. And of course, airway, breathing, circulation. We don't care about anything else if our patient's not breathing. So airway is a priority. But guys, you cannot be a robot. It has to be in the context of the situation provided because guess what? The test writers know that airway's been drilled into your head. So sometimes they will just put airway as an answer unnecessarily. Unnecessarily. Okay? So it has to make sense. And I said that Hesi is based on three things. Actually, it's four. The fourth thing is priority. And I know I said priority and delegation, but when I say priority, I mean in another sense. What I mean by that is which patient are you going to see first? And the way you figure out what patient's going to be a priority, say to yourself, who is most likely to die the quickest? And that's going to be your priority patient. So priority. Automatically, what goes on that list? Anything that interferes with the patient's physiological status. I'm talking about labs, I'm talking about vitals, I'm talking about glucose, I'm talking about fluid electrolytes, I'm talking about MI, I'm talking about seizure, anything that can affect that patient's physiological status. Automatically, that's going to be in the running, in the choices of priority patients. I do lots of teaching on this. I encourage you to sign up for a review with me, and I'll go in depth just to teach you how to answer these questions. I promise, if I can do it, you can do it.